my name's Steph, or Dr Stephanie Slater. I am a GP trainee currently working in London, and I'm here today to chat a little bit about mental health. I myself have anxiety and depression, and I've had some really tough times, but I've learned loads. I've got so many good coping mechanisms now, and I'm really trying to reduce the stigma around mental health. I hope you enjoy this. Okay, so what do doctors, okay, let's see what this says. What do doctors do for insomnia? So, I think sleep is so important. It is something that when I was recovering from being unwell with my anxiety and depression, sleep was one of my number one priorities. So I think this is such an important question. What I would say, for me personally, when I'm speaking to someone and they say they're struggling with sleep, I try and work out, is it the mind worrying? Is it that they're going to sleep fine and then waking up? Or is there a physical problem that's causing them to have trouble with sleep? And then what we do then is, once we've worked that out, if we do find it's something like the mind is just buzzing and buzzing right before you're going to sleep, we can then talk that through. And then I tend to ask, and how is things in the rest of your life? Is there stress going on? Do you feel worried about anything? Because oftentimes that can really affect our sleep. With insomnia in particular, for managing it, one of the things, if I do identify it and myself and my patients come together and say, actually, yes, there is a bit of stress going on, I'll tend to talk them through that and the ways that we can improve that. So with things like self-care, talking therapies, all that jazz, that was a bit weird, sorry. And then what we do is we talk about sleep hygiene, which I think is so important. So sleep hygiene is about things like dimming the lights before bed, staying away from technology, all these things that we probably know how to do, but maybe we're not doing so much because I'm exactly the same. I don't always practice what I preach. Sometimes I can't be bothered, but I think it's so important. And then the last thing is the medications. So there's things like Sleepio, which is a CBT, which is cognitive behavioral therapy to help with sleep. And then the last things are things like the medications. And there are some things we can prescribe short term. What I would say though is that I think, and often my patients will agree, that they don't want to get addicted to something. It's not something that we want people to feel they have to rely on. And so really trying to address what's underlying is what I prefer to do. And I always try and make sure that it's a shared management plan with my patients, that I check with them, are they feeling this, are they happy with this? And hopefully we can come together and make an agreement. So I think we can help. I hope we can all help. And if you're having problems with that, I think it would be great to speak to your GP. What do doctors... Oh, I think I cut my nails too short. What do doctors wear? Okay, well, I think this is a big range. So I would say that in hospital, especially with the pandemic, everyone's been wearing scrubs. They can be really comfy. Sometimes though, you find that they cut you off at the ankle and you look like you're wearing some weird type of 3/4 length, or they're just too small, or you can't find the right size. If we're not wearing scrubs, so for GP, I go for a smart casual attire, so you can really wear what you want. I think we try and keep the skirts not too short and the tops not too low, just because it is a professional relationship that we try and maintain. I really do want to make that relationship with my patients and help them as much as I can. But yeah, I think a variety is my general answer for that. What do doctors ask you about mental health? So it's really dependent, and I can't speak for everyone. If someone comes to me and they're talking about a physical thing, but I feel like there's maybe some outside stresses going on, or maybe something else that I can help with, I will often say, and how are you feeling? How are you doing? How is life going at the moment? Is there anything you're finding causing you bother? If someone comes to me directly and says, I'm struggling with worrying or low mood or anything like that, I'll say, first of all, could you tell me some more? And what I think is really important is to hopefully, and it can be difficult when we're all in a rush or if we're having a stressful day, but really trying to give patients and everyone time to just tell me what they want help with, tell me what they're going through. And then once I've got that information, we try and navigate through that together and decide about how we can help. One thing to say on that, because I just wonder whether this might be something that people are thinking, is with most of my patients, if I have any worry, or really if I'm talking about mental health at all, I do tend to ask them, have you had any thoughts of wanting to harm yourself? That isn't in any way judgmental. That is just because as a doctor, I'm really hoping that I can take care of my patients and help them feel safe and help them feel that if they were struggling that they'd have someone to talk to. And so I do tend to ask that. I do tend to ask that question. And I know it can be sometimes not a nice thing that people want to talk about, but I hope that by being open and by then letting them know that if they are struggling at all, they can call us. And then I know we're only here tend to be 8 till 6, but if it's out of those hours, there's 111, there's Samaritans. I just really hope that I can let my patients know that I care and I want them to feel that they can be safe. Sorry for the extra bit on that, but I thought that was important. What do doctors, oh, I've gone from the different sides, do to test for depression? So, there's not one particular thing, but there are a few different questionnaires. So there's something called I think it's called the PHQ-9. Sorry if I said that wrong. And that one asks about lots of different things. So it asks about whether you've been feeling down, whether you've been feeling hopeless, whether you've had any thoughts of wanting to harm yourself or anything like that. And so with some of my patients, if they're having trouble telling me things about how they're feeling, I sometimes say to them, well, should we run through this questionnaire? And it asks you the questions, and then you can get a score at the end of it, and it will put people into categories of mild, moderate, or severe depression, or nothing at all. And sometimes that can be really useful. So I find that with patients who I do that with, it can be a way of just saying, well, here's where you're at the moment, and how does that make you feel having that score? That's not to say someone's put in a box, and it's also really important to say that depression and low mood and worrying, it's actually something that's very fluid. I think everything's on a spectrum, and I really would hope for people who are feeling low or are feeling really anxious that they know that things can improve and that we care, we all care, and we want to try and help things get better. Thank you so much to Best For You for inviting me to here today to speak about mental health. I've had such a good time and I've loved answering all your questions. I really hope for anyone who is struggling that you know that you're worthy and deserving of support, and I really hope that you feel you can speak to someone if you've not done that yet. Either way, we're here for you, and I really hope that you can check out some of the Best For You information for more support. And I'm on Instagram as @Dr Stephanie Slater in case you'd find that useful to have a look at my page. I hope you have a great day, and thank you so much for listening. Bye.